Okay. Hello, and welcome to our 10th Food Safety Culture webinar. Actually, this is the 10th and a half because we're re-recording today because someone forgot to push the record button on the original webinar. So it'll be a little different format, but we're so excited that you're here and watching and getting all of this great information from all of our guests today. We are going to be talking about food safety management systems. Are they enough? And spoiler alert, I don't think that they are. For those of you who are joining for the first time, my name is Vanessa Kaufman. I'm the director of the Alliance to Stop Foodborne Illness, a program which brings together consumers, industry, academics, and regulators to work collaboratively to advance food safety culture throughout the food system. I, along with Chris Waldrop from the U.S. Food and Drug Administration, will serve as your moderators for today's event. And we did, but we won't be having Q&A today, unfortunately. Kelly, next slide. In this session, we'll be hearing from Dr. Kelly Stevens, Director of the Global Food Safety Center of Expertise at General Mills. The Center of Excellence is comprised of food safety technical leaders in food safety, microbiology, sanitation, food safety auditing, and regulatory compliance. Kelly joined General Mills in 2004, and prior to that, spent 8 years at the Campbell Soup Company in the microbiology and food safety team. We'll also be doing some audience polling questions, so make sure to be ready to submit your responses. We did do the polling questions. We can share those results. Next slide. Before we dive in, I want to remind everyone that the chat function, microphones, and your cameras are disabled. You will need to use the Q&A function to ask questions of the panelists. We have recorded the questions, but we won't be asking them in this recording. And as always, you can earn 1 continuing education credit from each webinar in the series. The details are posted on the STOP website and will be distributed via email. You will also find a recording of today's webinar and the copy of the slides on the STOP website. And of course, please be aware this webinar is being recorded this time. Conrad and Lone, the floor is yours.
Great, thanks Vanessa for that introduction, and thank you all for being here to talk about whether or not food safety systems are enough. And I know, I know Vanessa had a spoiler alert where she said she thinks they are not. Well, I'm going to go one step further and say they are not. And so we're going to talk about that today with our great speaker, Kelly from General Mills today. But I wanted to take a step back before we get into that and talk a little bit about why we chose this particular topic to discuss today. There have been a number of times I know that I've had this discussion with Lone and Vanessa, where we're at a conference and we see some great session titles, and we see many of them that have the term food safety culture in them, and we get lured into these sessions only to find out that they're not really about food safety culture at all, but they're about food safety management systems. And this has been, to some degree, a little bit disappointing when we've been at these conferences. But we've also noted that, this points to what we see as some confusion out there about the difference between food safety culture and food safety management systems. And I have noted that confusion also exists within the agency. But I don't want to say that in a way to minimize or degrade the importance of food safety management systems. In fact, FDA has done some research on the impact that food safety management systems can have, and the benefits that food safety management systems have on food safety behaviors. FDA has done research, particularly in the retail space. And we had a 10-year retail study called the Retail Food Risk Factor Study. And this demonstrated the value of food safety management systems. And what we found in that study, which was I think conducted about 4 or 5 times over a 10-year period to detect trends in certain behaviors. But we did find that those with food safety management systems routinely fared better in terms of compliance with specific types of food safety behaviors. So in this study, FDA measured compliance in terms of personal hygiene behaviors, dealing with contaminated equipment, looking at improper holding and temperature, as well as behaviors related to cooking. And we found that food safety management systems or facilities, whether they're fast food or full service restaurants with food safety management systems, consistently scored higher on all areas of compliance. And not only was it shown that having a food safety management system helpful, but the quality of the food safety management system also mattered. Those that had better or highly developed food safety management systems scored even higher. Now, all this is good news, but one thing to note is that food safety culture is not about a compliance mindset. The food safety study that we did, the retail study, talked about compliance to these behaviors, but food safety culture is more than just compliance. And so we want to spend some time today discussing that and discussing what distinguishes food safety management systems from food safety culture and mature food safety culture. In my mind, the food safety management system gets at the what we should be doing, but the food safety culture gets at the why. And so with that, I'd like to pass this on to my colleague, Lone Jesperson.
Conrad, I thought that was really interesting. And true to form, you're always positioning some facts that are really helping us just think deeper about what it is that we do in all sorts of food businesses around the world when it comes to food safety culture. Thank you very much for that. And I like the fact that you also have a study that runs 10 years because it says something around the validity of the findings that you spoke through. I'd like to just pick up where Conrad left off a little bit, and it's around this notion of compliance culture versus internalized culture, or low maturity cultures versus high maturity cultures. And I think exactly like Conrad said, we've talked about this many times, where we go to a conference or we have a presentation and it has food safety culture in the title, and we end up hearing very much around the system side of things. So let me maybe just put that into perspective as for what is it that we are talking about when we look at culture versus system. So if we can go to the next slide, please. In this perfect Venn diagram, all I really wanted just to illustrate there is exactly what Conrad was talking about, is to say there's something called systems, food safety management systems, FSMS, a well-known term for most of us in food safety, because we have regulators coming in, looking at them, helping us with feedback. The same for third-party auditing companies coming in, giving feedback as for how our systems meet requirements of to these external standards. So in these systems, we find programs like a HACCP program, an EMP program, sanitation programs. We might also find data. So what are we actually collecting? Verification data from metal detection units. We might find data from hand hygiene, like Conrad was making reference to as well. We might also find in our systems technology. So how are we implementing technology to better find foreign material that might lure their way into our food? So all of these programs, data, and technology make up what we refer to as systems in this webinar. And it's typically those entities, programs, data, technology that we are audited against, inspected against, and then also subsequent, there are some influence on behavior from all of those three types of systems. The other side of this Venn diagram is culture. So what we're really looking for is this perfect overlap between the two, because they are distinctly different. And culture, we're looking at values. What are the company values? What are your personal values? What are your beliefs? So those very deep-rooted beliefs around what's right or wrong when it comes to food safety. And what kind of norms are we seeing in the workplace when it comes to food safety? So how do we onboard a new team member into our team and hand over some of those expectations or assumptions that might not necessarily be written or documented in any way, shape, or form in our systems? In the culture, we're also talking about psychosocial risks, and I'd like to just hone in a little bit more into that part of culture, as it's something that really helps us connect these two bubbles into a perfect Venn diagram. If we go to the next slide, it's just to dive a little deeper into, so when we talk systems, for example, I mentioned that it could be made up of programs, data, technology. And in this case, this is an example we hone in on then. So what is it about the system side when we talk about hazard that we're looking for? We're looking for, do we have a hazard team? Is there documented and verified process flow? Do we do a hazard analysis? How do we manage the hazards and the risks that were therefore coming out of that hazard analysis? If we dive into the psychosocial side, on the culture side, we look at job control, role clarity, relationships between each other. So it goes a little bit back to the norms side of the culture equation. And also, what kind of support do I feel that I get from my direct manager every day when I come to work? And that's really some of the classic 4 components of psychosocial hazards and risks. If we look at the next slide, just to go a little deeper on that particular one, there's some great work that has been done in other high-risk industries, and I would very much put food safety and the food industry into that as well, a high-risk industry. So we know how psychosocial risks have been quantified in other industries. For example, we look at job satisfaction. Is it high, low? Ability to complete your work tasks within the normal hours. Yes, I can do that. It's highly likely that I can, or no, I can't do that at all. Is there collaboration across a department? Yes, it's high or it's low. Can I influence my workload? High degree, yes, or no, I can't do that at all. And then finally, do I get support from my supervisors, colleagues when needed? Yes, I do, or not at all. So by asking these types of questions, we can get actually a gauge for how high is the risk from these psychosocial factors and hazards, and that therefore influence the degree of our food safety risks. And I think that's where the newness comes in here, as for how do we connect those 2 sides of the Venn diagram. And the most really at the forefront program or way to do that is if we look at that hazard analysis and we actually start to incorporate some of these psychosocial factors and risks. So let's look at what that looks like. If you go to the next slide. So we have this classic risk assessment. You all know this because this is what you do every day, many of you. We look at a food safety. If we go to the next one, we'll look at a bit of an example here. If we go to the next one, please. Thank you very much. So in this case, we're looking at a chemical hazard. It's a cleaning chemical residue. And we look at severity. So if this cleaning chemical residue finds its way into the product or into the food, what's the severity of that? And in this case, the team has assessed it to that it could cause a product recall. At the same time, we say, how likely is it that it'll make it into the product? And they've said, okay, we have all of these swabbing and testing, and we do all of this verification that our cleaning efforts are the way they're supposed to be, and we've validated that it can do what it needs to be doing, and therefore it's not expected to occur. It's a very process way of looking at a hazard analysis and risk assessment, and we then give this score high, medium, low. So a little bit of a recap there, but that's part of our food safety system to go through an assessment like this, part of the hazard program. So if we go to the next slide, then what I'd like to just challenge all of you with is, and it goes back to Conrad's point around this compliance culture versus a more mature culture. If we then say, if we put psychosocial hazards together with our product and process hazards, then we actually get the true consumer risk that we're dealing with. And if we go to the next slide, we can see a little bit of why that is. We have the same hazard, the cleaning chemical residue. We're still dealing with the same one. We have the same severity. We cannot change that. That's part of the impact if this actually cleaning chemical residue makes it into the product and into the consumers, or directly to the consumers. And in a actual or sort of classic risk assessment, we might have somebody that says, you have to clean it this way, and you have to there after that go and test for if there's any residue left, and once you've tested, you need to put that result into the spreadsheet and then just file that. And that's it. So then I go to Conrad's great point around saying that systems is the how. And when you then take culture and add that into the equation, then you get the why as well. But in this case, there's no discussion of why. It's been told to this individual that this is what you have to do, and so go do that. So the likelihood of this residue being in the product might actually be slightly higher because of this, just go do this, this is part of your job, there's no reason discussed as for why you have to do it. So the likelihood is now known to occur, and our scoring could be high. If we then go to the next slide, so now we have a different situation. We still have the cleaning chemical residue. We have the product recall and severity. Again, we can't change that. But now, instead of just telling me that I have to go test for whether there's any residue, I've also been told that you and your team can actually, by doing this, act to improve our cleaning actions. So we now have control over our jobs. We have influence on how it's done. And we know from our manager that we're supported in doing this so that we can do the best job possible. And now the likelihood for this particular hazard to make it into the product is actually lower. And therefore, we're now seeing a risk score of low. So by just sharing these two scenarios, I hope it just gives you a little bit of extra sort of input into saying, how do we connect culture and our systems? And how can we use something that many of you already work with, the hazard analysis, to systematize how we bring culture into the assessment of risk. If we go to the next slide, just to wrap it up, we've got Kelly Stevens, as Vanessa said, is going to join us as well. And what I really appreciate every time that I speak with Kelly about the topic of culture is this linking culture to climate, and also to what I would argue are the psychosocial risks. Because if we have the overall company culture that's going to influence those norms and the climate that you're experiencing every day you come to work, that's subsequently going to influence the psychosocial risks that I just discussed with you as well, and the magnitude of them, and therefore the impact on the risks that you're actually dealing with in your company every day. With that, I'm going to hand it over to the wonderful Kelly Stevens, and I look forward to hearing everything you have to say, Kelly.
Well, thank you, Lynn. Thank you, Conrad and Vanessa. If you could go to the next slide, please. You know, I always appreciate listening to Lynn and to Conrad on this topic and their thought leadership. I learn something every time we have a conversation. So as we get started, I just want to say how much I appreciate the opportunity to be a part of this fantastic webinar series. And what I'd like to do today is share a little bit about General Mills and our food safety journey. At General Mills, we've been making food the world loves for more than 155 years. Our team of more than 30,000 creative employees make food with passion every day, having fun and staying true to our values along the way. When you think about that, that's more than 30,000 people making food safety decisions every single day. Next slide, please. On the slide, picture of some of our brands, hopefully some there that you're enjoying today, and the diversity of brands, which I love, right? Pillsbury, Cinnamon Toast Crunch, Annie's, all bring different challenges. And as a food safety professional, I love our brands, and I love the diversity of food safety challenges that each brings. Always, always, always something new to learn. Next slide, please. So at General Mills, our values really set the foundation for our culture. And to understand our values at General Mills, it helps to understand our history. So I'll take us back May 2nd, 1878. It began as any other day at the Washburn A Mill, which was the largest mill of its time in the United States. That evening, flour dust in the air ignited, and the mill exploded. The blast blew the roof off of the A Mill. It leveled 5 other mills and engulfed several city blocks in flames. Sadly, the massive explosion killed 18 workers. When Washburn, the founder of General Mills, heard the news, his immediate concern was for the families of the employees and others in the area who were killed or injured by the explosion. He initiated a fund to help, and he made sure that the workers displaced by the loss of the mill could continue working in another mill. Washburn was determined to prevent a similar disaster in the future. Washburn had heard of a new device that would successfully deal with the millstone exhaust and prevent flour dust from clouding the air. Once the devices, eventually called dust collectors, were installed in the mills, the flouring milling process, the industry became much safer. Washburn also shared these innovations with his competitors because care for people, prioritizing safety, and a culture of sharing then and now continue to be a part of our culture at General Mills. We lead with safety, human and food safety culture is a subset of our corporate culture and values. Do the right thing is foundational, and it is the lens through which we make decisions and we hold each other accountable. Next slide, please. So food safety management systems are the backbone of our food safety programs. Our food safety management system has been a work in progress for more than 60 years, and we continue to evolve. Some highlights of our history for today. Our food safety policies and standards were established in the 1960s. Today, our policy team is 20 members strong, representing food safety and quality, manufacturing, research and development. All of the policies are vetted and signed off at the senior leadership level, also known as management commitment. Making safe food for astronauts. More than 50 years ago, Pillsbury and NASA collaborated on the development of HACCP principles. At that time, HACCP was a significant development for the food industry with its focus on prevention of potential food safety issues, not just inspection. And as we all know, it's still very relevant today. As we move into the mid to late 2000s, we started to include culture elements into our policies and standards. We were confident that we had the right elements in our food safety management system expectations, also known as the what. What we wanted and needed to work on was the how. The question that we asked ourselves was, how do we improve our food safety performance? How do we prevent repeat issues, for example, whether within a facility or across facilities? How would we accelerate our ability to detect potential issues and prevent them from reoccurrence or even happening in the first place? So in order to do this, we started to reimagine and think about what it would take to achieve the goals. We started work in 3 areas. First, in our self-inspection programs. If we can find it, we can fix it, and we can prevent it. Side note, I wanted to call it Project Fifi. Pink puppy dog logo. It was going to be great. I was not awarded naming rights for this project. I'm still looking for the next opportunity. So in addition to our self-inspection programs that we worked on, the second thing we worked on was the development of food safety metrics, and the third was food safety training. And remember, at General Mills, food safety is everybody's responsibility. And as we looked at that training, we needed to have training that people needed as appropriate for their role. And we took the lens of, could we engage the hearts, the hands, and the minds of our team members with the training? As subject matter experts, we learned about adult learning principles. We began to share our training with external partners like suppliers and co-mans, really changing how we thought about it, and we continue to evolve with it today. And this really started our journey of our belief that with a foundation of sharing transparently and with a continuous improvement mindset, that we would be able to elevate our food safety performance. Next slide, please. So I think we started with the question, are food safety management systems enough? And as I reflect on the journey, which we are still on, I wholeheartedly believe that by nurturing a culture of sharing, not just the good, but the bad and the ugly, nurturing a culture of transparency, and celebrating a culture of continuous improvement in combination with a strong food safety management system, you will elevate your food safety performance. So how does that all work at General Mills? Our corporate policies are signed by our CEO. Our corporate policy states that every employee is responsible for food safety, and that the Food Safety and Quality Organization has the responsibility to develop food safety and quality policies that we talked about. Every year, employees are also asked to review a corporate code of conduct, which includes food safety expectation. Our Food Safety and Quality Vice President reports into the Board of Directors quarterly. Our food safety policies dictate global minimum expectations for our food safety management system, and we verify compliance through a combination of self-inspections, internal audits from our central team, and we have our food safety metrics. So let me share an example. At our manufacturing sites, we performed monthly self-inspections. Here's how the process used to go. Schedule time on the floor, you generate a list, you assign a score, possibly debate on that score with your partners, and you repeat it the following month. The challenge here is the self-inspection or that audit is a point in time. Any incident that happened outside of that inspection time frame was not counted as part of the score. Therefore, you could argue that the audit score was not a good representation of the entire reality of what was happening at that facility. So we moved from a point-in-time assessment to an assessment that incorporated all of the data and the incidents that happened every month. And with that, sharing became an expectation, sharing findings internally and across the enterprise. In other words, we began to reward finding it, fixing it, and preventing it behaviors every single day, instead of rewarding audit performance at a point in time. Now, our internal food safety auditors also needed to evolve as well. From the perception of a gotcha approach to finding noncompliances and the finding it, to having this team be able to connect our manufacturing sites to the resources needed to ensure site food safety program execution against the policy expectations, the fixing it could happen more easily. Because if our internal assessment programs are strong, we would expect our internal audit team to find less, because our resources at the site are finding it more often and being able to react to the data. So next I want to talk a little bit about food safety metrics. At General Mills, we have food safety metrics that assess food safety execution and performance against our General Mills policies and standards. This is a quantitative tool that's used to monitor food safety performance across all of our facilities, so we can track and trend data year on year. The metric is used across the organization, it is universally understood, and it is used to prioritize resources. Some might say it's the love language of General Mills. Now let's talk a little bit about General Mills culture. We talked about the expectation that doing the right thing all the time guides our decision-making. Leadership behaviors are included with all of our annual priorities. We measure performance against them with organization-wide surveys. So this means as a manager, I receive a culture scorecard based on survey data from the team that I work with. Red, yellow, and green metrics with a comparison to a peer set. I remember early on receiving results from one of my first culture scorecards. It wasn't pretty. It wasn't the data I was hoping to see. What I found out from that scorecard was I had blind spots that needed work, and it was a lot to process. I dug deep to understand, and then I shared it transparently at a team meeting. Vulnerable, scary, yep. I shared the data, and I thanked the team for being honest and giving me feedback that would help my growth and help me be a better leader. I continue to work and prioritize my development based on feedback I continue to receive from the team. I'm appreciative that I work with a team that are honest, courageous, and care enough to provide candid and caring feedback. So why is this so important? We want our employees to be transparent in communicating food safety risks. And as leaders, we need to ensure that we're creating an environment for people to not be afraid to share the gory details, or a psychologically safe environment. We want them to not be afraid to share the bad news, and we need to remember to celebrate the good news. Next slide, please. So while many say that food safety culture starts at the top, I believe that food safety leadership starts with me. I strive to be the food safety leader people choose to work with and choose to work for. When people call me with an issue or when I'm working on an incident, people are looking to me to gauge reactions. Makes a difference how I respond. And I want to respond in a way that allows all perspectives to be heard. This means I need to seek out and be receptive to feedback on both the what and the how, I need to build trust, and I need to be connected. For me personally, it's a continuous learning process. Next slide, please. So as I said earlier, I believe that a strong food safety management system in combination with nurturing a strong culture that includes a culture of sharing, celebrating continuous improvement, it is necessary for food safety performance that is needed for today's business success. I would say it's a business imperative. One final note, on this slide, I was shared a picture of a handwritten note from a senior leader in our organization. I received this thank you note after the execution of a large marketplace action. Our senior leaders took time to send notes of appreciation to the team who worked on the incident, thanking us for the hard work, protecting the consumer and protecting our brands. I use this as a great example of how our leaders live and model the values that we have as an organization. It is a great example of how our leaders demonstrate their support for food safety, doing the right thing every time, safety first, belonging. So thank you.
And thank you, Kelly, for sharing your experiences with us. This is so valuable. Kelly Lombardo, will you go to the next slide? And keep going. And keep going. Thank you so much, and please join us for our final webinar in the series, live from the Food Safety Summit on May 9th. It's a hybrid event, so those attending the summit can join in person at the closing session, and those who can't make it, as always, are welcome to join via Zoom. We'll be welcoming back some of our fan favorites to the stage, as well as some new voices to discuss the ongoing journey of food safety culture. We hope to see you there. Thanks so much.